good afternoon, everyone. My name is Martin Ryman. I'm a professor at the University of Arizona, and I'm directing the HAI Human Animal Interaction Speaker Series for our College of Veterinary Medicine. Today, it is my pleasure to introduce our featured speaker, Dr. Jason Stull, who is an associate professor in veterinary medicine at the University of Prince Edward Island. Jason has published over 50 peer-reviewed publications and numerous book chapters and contributed a lot to our field, and over the past 10 years has taught and conducted research in various areas related to the spectrum of care. He holds a veterinary medical doctor from the University of Pennsylvania, a master's in preventative veterinary medicine from the University of California in Davis, and a PhD in veterinary infectious diseases from the University of Gulf. He's an editor in our top journals, and I'm really excited to have you here, Jason, to talk about maximizing benefits and mitigating risks in animal-assisted activities, a very timely topic. So thanks for being here, and the floor is all yours.
Well, thanks, Martin. I really appreciate the offer to come and speak with you. I I've had a variety of different careers, I guess, through my time. I've worked in public health as a veterinarian within public health. I've worked and I still work within infection control in veterinary hospitals. I've been always very interested in zoonoses, and I think that's one of the reasons, I guess, that all of those different pieces kind of come together around this topic. So something I'm very passionate about and looking forward to chatting with you about today. I'll try and keep it probably around the 35-minute mark for kind of a formal talk and presentation, and then definitely at the end would love to discuss and answer any questions you might have or do whatever it is. So getting started. So I think anytime I talk about health risks, I feel it's super important to also talk a little bit about the benefits. It's as Martin and I were kind of chatting a little bit about before we started, one of the key drivers of course of animal contact, of perhaps pushes for involving animals in a variety of different settings that we and interact with them throughout our society. And these we can, this is just a couple that are noted here, but certainly we know that this human animal bond that exists, this strong bond between people and pets, number of direct and indirect benefits. And so we certainly know decreasing stress and anxiety, decreasing loneliness and depression, actively decreasing risk of cardiovascular disease, and in certain groups, even perhaps having greater benefits. So we know with children, those individuals that grow up with pets in the household generally have better self-esteem, empathy, better social skills. We know that pets are certainly considered part of the family in many cases. Read one statistic at one point that was something like individuals were more likely to sleep with a pet than other individuals in their bed. So we can take that for what it's worth. Families often buy pets holiday gifts. Children are considered the relationship with pets to be perhaps as important, if not more important, than with other people. We also know that pets can oftentimes be a catalyst for harm reduction. And we'll talk a little bit about that. But for instance, concerns around secondary contact with smoke and in a household for a pet might, for instance, encourage an individual in that household to stop tobacco use or stop drug use. And so there can be a lot of very beneficial direct and indirect impacts from pets. Again, not super surprising, we know that the majority of US and Canadian homes have at least one pet, and we know they fall somewhere around, certainly dogs and cats are very popular, but a variety of other species are present. What's maybe a little bit surprising to some of us is that, at least in some of our work, we've identified even amongst those households that don't own a pet, there is a high amount and frequent or animal contact. So this means encountering animals in a neighbor's household or a friend's household or in the park or whatever. So we definitely have a huge amount of contact with animals in our society. I know that probably it's a little bit of small on your screen, but it's a nice study that kind of really classifies and kind of teases out a little bit of the contact that people report. And so this was in Canada, and they were specifically looking at of respondents in Facebook study, what individuals, a proportion of individuals had direct contact with animals or animal food waste or habitat within the past 7 days. Unsurprisingly, nationally, just about 60%. And that maybe isn't super surprising or interesting, but what is interesting are some of the different types of contact that people have, and they sometimes are hard to actually tease out. So, for instance, reptile contact, about 1 to 2% of respondents had contact within the past week. When we think things like rodents, horses, pigs, so again, relatively small amounts, but perhaps identifiable. Raw pet food, about 2%. So some interesting kind of things as we tease out and we get to and we start talking a little bit about some of the health risks that are present from different types of animal contact. And as I was alluding to, huge push to get animals involved in various types of healthcare facilities. And so whether we're talking about assisted living facilities, whether we're talking about more formal types of healthcare facilities, there's a huge component, and some of that is from some of these benefits that are here. Some of that is from the economics because this is what they're being asked by, for instance, individuals in those facilities. And so when I say builders of social capital, so we know pets help people develop networks amongst social networks. So an individual who's sitting in the park with their dog is probably much more likely to be approached by strangers than someone that's sitting by themselves. Harm reduction, I talked already a little bit about secondhand smoke, and motivators for healthy behavior change. Treatment plans. So we know that people that have a pet as part of their treatment plan, whether it's walking or whether it's doing other types of physical exercise, are much more likely to be successful in completing that plan and actually doing more of the actual activities. And there are these sometimes perceived, oftentimes difficult to quantify benefits to both patients and their staff. And I have here this picture of rabbits. And so I have this here because when I started one of the projects that I'll talk about today, I was really kind of approaching it from the health risk component, which is where a lot of my training has been in. And we were at a facility, we were doing a walkthrough in an assisted living home, and there was one particular individual likely suffering from dementia or something similar, and she was clearly, the staff was having some difficulty kind of working with her and trying to settle her down. And then in came a wagon, I kid you not, with rabbits that for whatever reason were sitting in the wagon, and they take this wagon throughout the facility, and her demeanor completely changed. So N of one, I know, but it was so impactful to see just the fact that these animals moved into her space, her ability to touch them, how that really alleviated a lot of her stress, the stress of the individuals working in the facility. And so just these benefits that are likely present in many of these facilities. And we don't have to get into the semantics of this, but there's obviously a lot of different ways that animals come into some of these different types of non-home environments. So whether we call them animal-assisted activities like reading groups, whether there's a therapy component to it, such as rehab, or whether there might even be service animals, there's a variety of different pieces that perhaps need to be addressed and thought about when we think about kind of these different types of facilities. And because it is Halloween, I feel it's only appropriate. So I was telling Martin that, Halloween actually has been pushed back a day here because we have a major storm coming in this afternoon. But yes, people engage with their pets in various ways, right? And so whether it's, dressing them up as the donut person or donut individual, whether it's the little whippet with the pom-poms, whether it's other types of components. But with that, all of these positives, it's super important that we also show the devastation which sometimes happens, right? And so this is a case of capnocytophagia canamorsis, very uncommon overall, but this is basically a pathogen which is in the mouths of all dogs and under certain circumstances can cause devastating disease. So not unusual for people to have limb amputations following this infection. And so gets us to the conversation. So there are these benefits, but there absolutely are some risks that we need to think about when we discuss animals in various types of various types of interactions. And so briefly, we're going to kind of walk through this concept when we think a little bit about zoonoses. Number of different pathogens. Obviously, this number continues to grow as we have emerging pathogens. We do more work in better quantifying or understanding what role, for instance, animals and specifically pets might play in some of these. But certainly greater than 70, and multi-drug resistant organisms continue to obviously play a role. It's challenging in that many of the animals that we work with may be what we think of as subclinical shedders. In other words, a dog that is shedding salmonella, in general cases, is happy, walking happily, doesn't have diarrhea, and yet we can detect salmonella in their feces. We know that, again, many of these organisms might be emerging or what are called re-emerging, so maybe ones that aren't even on our radar. And even dogs, for instance, visiting human healthcare facilities have different risks. And so we know, for instance, that dogs, the risk of acquiring MRSA and C. diff were 4.7 and 2.4 times greater than dogs that had dogs that visited kind of human healthcare facilities, were higher than in dogs that visited human healthcare facilities than dogs that did not or had other kinds of animal assisted therapy. So we know just the fact that animals go into some of these facilities can actually increase their risk, and then the possibility of these animals now transmitting these pathogens to other people, for instance. And I'm not going to get too much into the non-zoonotic stuff, but I think it's also a really important component to think about, which are what are the impacts outside of infectious diseases that we need to consider. And so certainly things like allergies to a person or participant, bites and scratches, and even psychological fear. So, is animal assisted therapy right for everybody? Probably not. There are people that are afraid of animals. And so are we doing our due diligence to actually ask about that before we start integrating animals into a healthcare regime? And then this also gets at the other end of it, which is the welfare for the animal themselves. And so what does that look like in terms of when we try and quantify what that should look like and what are the best practices for that type of process? And we've written up about some of these zoonotic concerns, and obviously folks can feel free to take a look at the paper. If anyone's interested in any of the things that I share with you, feel free to email me. My email will be on my last slide as well. But we've tried to quantify to some extent some of the pathogens that are of greatest concern, perhaps for animal or pet assisted associated infections. And of course, yes, they span the different types of pathogens that we think about. So bacterial and viral and parasitic and fungal, we can address them and see them in all the different types of animals that we might generally interact with in any of these types of either at-home or non-home environments. The incidence in people is oftentimes really, really difficult to figure out, which becomes a challenge when we want to think about kind of risk assessment. So if someone wants to know, well, what's my true risk of interacting with a healthy dog, it's oftentimes difficult. So many of these pathogens that we detect in people, they're not reportable. It's oftentimes very difficult to determine the source of the particular pathogen in the person. So whether salmonella came from undercooked food or from other types of sources, such as, for instance, a dog that is fed a raw diet or chickens that are involved in some type of animal-assisted intervention. And so unraveling a lot of these pieces becomes incredibly challenging. But what I try and do is I've been able to when I talk about this topic, I highlight what I call the Z, or if you're in Canada, the Z team. So this is the zoonoses team. So anyone that remembers the A team, so thank you if you're old enough to remember that. And I'm not talking to a bunch of 20-some-year-old veterinary students, because that's how I feel like most of my life is, and they don't get half of my jokes, probably because they're not funny anyway. But when we talk about the Z team, there's a couple of animal groups that really need to be considered. And so these are those animals that absolutely play a bigger proportion or bigger role when it comes to zoonotic disease infection in people. And some of these might be a little surprising. So for instance, young dogs and cats. Overall, cats and dogs probably play a fairly small role, but under the age of 6 months, absolutely a much greater risk when we think of various zoonotic pathogens like Campylobacter or various endoparasite worms. We know dogs and puppies in particular, and individuals and young individuals in these households have a much greater risk of Campylobacter if there's a puppy in the household than if there isn't a puppy in the household. And then one in particular study was able to actually calculate the attributable fraction from this. So dogs or puppies in these households accounted for about 10% of salmonella infections in this population. So that's pretty impressive, actually, when you think of all the other contributors, something like Campylobacter. So we have that group. We also have rodents and exotics, maybe not a huge surprise, but groups like gerbils and hamsters and guinea pigs, and exotic species like chinchillas and hedgehogs. And so high prevalence of pathogens like salmonella and some some kind of unusual things like LCMV, lymphocytic choriomeningitis virus. That's very common in some types of mice and rodents. So we need to be considering these. When we think of young poultry and livestock, hopefully a bit of a no-brainer there, but we think of things like Salmonella, E. coli 0157, various other types of components like C. diff, Clostridium difficile. So a variety of components there. And then finally, our group, the reptiles and amphibians. And again, hopefully not too much of a surprise with this group, that reptiles and amphibians, obviously the big player here is Salmonella, and they're kind of just normal colonization with that bacterium and the ability to transmit to people. And so when we think about something like reptiles and amphibians, this is just a recent study that came out of a group in Canada, just to highlight that these zoonotic risks are not generally uniform amongst people. In other words, I'm going to highlight here, we've got different animals that were in these households that were considered responsible for salmonella transmission in these households. And we've got the proportion based on age group. And so if we look at that less than 10-year age group, we see a much greater proportion of cases than what we would expect in these households based on general population. And that's not overly surprising. We know this group, specifically the younger group, will be at greater risk because of either a combination of developing immune system, infection, or I should say hygiene habits that may be less than perfect, and various other pieces. So we can kind of take a lot of these components we talked about. We've got the animal piece, we've got this human piece, and so we think about, yes, the young, but we also think about the elderly, those generally over 65 years of age. We think of pregnant and immunocompromised, or this YOPI group, as greater risk of either both getting infections and then getting severe infections when it comes to just infectious diseases in general, and certainly true for zoonotic organisms. And we can also bring in other components. And so when we think about what that might look like for risk assessment, and I bring this up because when we start to make decisions, or we have a specific goal in mind when we're thinking about, for instance, involving animals in some type of intervention or interaction, we have a number of different decisions to be made. What animal species are we going to use? What veterinary care do they provide? Who's the recipient of that? Where does that occur, that type of interaction? And we think about each of these, and there is going to be some type of risk, component or categorization as we think about that. So starting at the top from perhaps would be the lower risk to a higher risk. And so when possible, thinking about how do we trade out a higher risk situation for a low risk situation. So we can think of, again, along that risk spectrum from mature dogs and cats to involving something like reptiles. We can think of the recipient being someone who's immunocompetent to someone who's within that YOPI category. Or if we're thinking about healthcare facilities, maybe that combination of we're looking from that, an adult rehab facility to a hospital facility, or even amongst pediatrics. Some of these times we have very, very clear goals that we may have to obviously address some of these higher risk individuals, but really thinking carefully about how we bring these three groupings together, and these decisions we make can have huge impacts on the likely risk for zoonotic disease transmission. And so for those of you who are saying, well, these are all theoretical, let's talk about real numbers. And this is hard, but what we can say is, okay, look, anyone can scroll the internet and find plenty of probably higher risk activities that we know our general population engages in. So we've got a variety of different pieces that might result in either adverse types of interactions with an animal or zoonotic transmission. We can think of the young poultry that every single year result in salmonella outbreaks in various places. We can think of here, don't even know it. I think this individual over on the back is clearly kind of upset about the decisions that this adult is making. And then I don't even know what we say about this. So animals and people, obviously interesting components when it comes to risk perceptions around things like zoonoses. And when we look at how does that manifest within, for instance, animal-assisted situations, we can talk a little bit about that. So we did a little bit of work back in 2018 that we published. So we went to, did a survey of a number of Ohio institutions and nursing homes, assisted living groups, and asked them a variety of questions, some of which were Do they have policies for these different types of species to be allowed to live or visit their facility? So these were nursing homes. And had one of those particular animals lived or visited in the past 12 months? So we can see that, not too surprisingly, the vast majority of them, I think it was like 99% of those facilities that participated, actually allowed for an animal to come in. Not overly surprising. Cats and dogs, totally fine, maybe in most cases. And then we start to get into some kind of questionable, and I kid you not, in the facility. So farm animals, yes, goats wearing diapers. Incredible kind of concept of what that might look like. And in terms of infection control risk perceptions, we had some higher risk animals not only perceived to be or allowed to be come into these facilities, but actually had been present in some of these facilities. And then when we look at kind of what's actually happening in these facilities in terms of protocols to try and reduce transmission, we find some big gaps. So most of these facilities had some type of policy, as you can see. And so we tried to break it down here and by whether those facilities actually quote unquote own that pet. So many facilities, nursing home facilities, assisted living facilities will have animals that are actually part of the resident, that are actually residents in the facility. So these are oftentimes cats, and they might be other animals as well. Whether the residents are allowed to bring their own animals, and then whether they're allowed to have visitors that bring in animals. And so if they have policies on these various things. And so we're hitting around the 70% mark with those. And we can look down toward what those policies actually contained or didn't contain. And we saw some big gaps, right? So something as simple and important as hand hygiene, so performing washing hands with soap and water and or alcohol-based hand sanitizer, only happening in a minority of those particular, or at least required a minority of those areas. Specific areas in the facility where animals weren't permitted. So for instance, maybe there are high risk areas. So for people that are more likely to have to acquire a zoonotic disease, or in eating areas, or in food preparation areas. The species restrictions. So again, very few of them actually disallowed things like certain types of reptiles and groups. Age restrictions, again, thinking about some of those young animals and some of those concerns. So a lot of gaps that are there. And if we look to literature and try and better tease this out, there have been a couple of nice systematic reviews that at least highlight some of the challenge, I guess, more than anything. And so here's one from a couple of years ago, or about 10 years ago at this point. So about 36 articles were identified, and the challenges are there's huge heterogeneity in a lot of the data. In other words, the age of the individual that are being used for the particular type of intervention, those that are receiving the intervention, the way that we're actually able to actually try and measure some of those components, incredibly heterogeneous, which makes it difficult to oftentimes measure across these different types of articles. Evaluating, for instance, at the top, evaluating risk of a zoonotic transmission in a university AAI program. So here, not surprisingly, yes, they are going to identify some zoonotic organisms through screening, which is what they did. Another particular program where they had a 16-year program and at least an averaging approximately 20,000 pet therapy interactions per year. That's pretty impressive, with no documented pet-associated infections, which gets back to the challenges. How well are we actually able to document them, and are we actually able to capture some of those data? And then from another particular study looking at, again, entitled Risk Associated with Animal-Assisted Intervention Programs, about 29 studies, and huge challenges with what that looks like in terms of infection control practices that are happening at many of these different programs. And so a lot of gaps that are there. A few data actually confirming transmission, so that's probably overall a good thing, but absolutely these risks are present, some of them documented, and so need to think a little bit about what those vulnerabilities might look like in a program as we think about how do we safely involve animals into some of these interactions. And before we say yes, but we're involving groups that are well known. There are groups that have, therapy dogs, that they have existing requirements for their programs. Nice paper to kind of look at what those programs actually evaluate those programs for what those animals know or are tested for, vaccinated for, etc. And so a number of different kind of gaps that come in. And so just generally what we've got here is we've got these group one and group twos. And so the group one were these national therapy animal certification organizations. These group two was a representative sample of US therapy dog organizations as well, and then asking around various types of kind of best practice themes. And so as an example, so leptospirosis vaccination only given to a small proportion of these animals, even something like Bordetella, again, which can cause certainly disease in animals, and in some cases actually can even be a risk factor for human disease. We look at flea and tick preventative. So again, many of the pathogens that we get concerned about can be transmitted from these ectoparasites, so important to try and reduce them. And again, big gaps there. And then raw meat diet. So we do know that these animals can transmit once they're fed a raw meat diet, are much more likely to shed salmonella, as an example, in their feces. So a lot of concerns that are there when it comes to some of these existing programs. So how do we get there? How do we maximize benefits and get these animals involved, engaged in some of these programs while trying to minimize risks? And this gets back to, I talked about this theme of kind of infection control. And so when I'm talking to veterinary students, I use the exact same type of slide where we kind of can hit on some basic concepts that we can integrate into our programs. We won't always maybe be able to optimize every single one of these, and that's okay based on maybe the program or other types of challenges. But if we have enough redundancy across them, then we're going to get at our main goal, which is to try and reduce transmission. And so I think most of these are probably pretty familiar to folks. So personal protective equipment here is like gloves and gowns in some cases if we need to, or even just using a sheet, for instance, under or over a patient when we're bringing an animal on. Preventative health care, the type of contact that occurs, so what is allowed, what isn't allowed. Education, both of the recipient who's involved in that type of interaction, but as well as education of those that are responsible for actually running the program. Antimicrobial or antibiotic use by animals that are involved can be a big player. So I think that's the vast majority of them. So let's talk a little bit about it. So first off, there are some good guidelines that help to drive some of these. So if you're not familiar and you are engaged in involving animals in facilities, this is a useful kind of best practice document to help kind of look at what that might come together. In Ohio, when I was there, we also developed this particular kind of adaptation from those guidelines to say, well, what might that look like in a nursing home? So we don't have the same levels maybe of risk, but different types of questions and challenges that we might encounter in a nursing home. So we developed kind of this best practice protocol for groups to fill out and complete. We've also developed some resources to help engage, for instance, places where animals are coming into. So these could be resources for animal owners or handlers, if, for instance, are coming into, whether it's anything from a school to a nursing home, or for long-term facility, pet visitation type groups that are engaging in having those animals. So what might be important things to ask about and to engage people about? And I'm just going to kind of highlight additionally in a second, kind of some of what those might look like. But for those, again, that aren't as familiar, AHA, the veterinary group, kind of put together some guidelines to help us as veterinarians think a little bit about what might that look like from a preventative care standpoint when we think about how do we care for that animal, what type of preventative measures are we thinking about in animals that are engaged or involved in those. So I'm just going to highlight, just in the last couple of minutes, a couple of examples of what that might look like. And this is going to, of course, vary by setting, vary by all those different kind of components that I spoke about in the beginning. So depending on the types of animals that are involved, people that are involved, the setting. And so when we think about what these programs might look like, we want to see a policy that's in place. So the number of times that I've been asked to kind of weigh in for human healthcare facilities that don't have a policy. They might even have animals involved. And it's super important, obviously, that we all get on board and understanding what does this look like? What are the requirements for animals that are going to participate and for the people that are going to be involved? We ideally have a coordinator that's there to kind of ensure that these policies are maintained and used, and ideally a log of so where what that looks like when it comes to the animals that are involved and the people. And part of this is obviously from a zoonotic disease standpoint, but I would say equally important is we need to be able to showcase and figure out what benefits we're seeing. And there are a variety of different ways of trying to do that. But I would encourage people that if you are involved in any of these types of best practices, how do we actually begin to quantify and begin to actually capture data around some of those benefits? Super important. Subject matter experts are going to be incredibly important as we develop. So training for all those involved and auditing systems. So are people actually doing what we think they're supposed to be doing? Are we looking at adverse event reporting? All of those types of various pieces. When we think about what this might kind of how this might come together. So individual animals that have had recent gastrointestinal signs, such as vomiting and diarrhea, respiratory signs, skin disease, these are animals that really shouldn't be participating in those types of interactions. Animals that have recently been on antimicrobials. We know many of these antimicrobial resistant bugs are able to be transmitted across species, including from animal or non-human to human. So definitely something to think about. Obviously having an infectious disease, we talked a little bit about the raw meat component, some type of veterinary involvement to ensure that we have the ability to ensure this animal has been evaluated to be considered to be healthy on preventative care, all those types of things. Right pet, right person, right context. This gets back to, again, we have a lot of decisions that we can make. How do we ensure that decisions are good ones? And so are we going to involve in that healthcare facility this dog or this turtle? I think it's a pretty no-brainer, right? So I can tell you the number of places I was at one particular place where they had, kid you not, poison dart frogs that were at the facility. Why poison dart frogs? I'm not really sure. Now, to be fair, we all know poison dart frogs are only become poisonous when fed certain types of insects, but nonetheless, and they're beautiful, but okay. Um, and what we think about and how we deal with the environment in which those animals are. So there was one particular facility, they were super proud that they had just had turtle races in this facility on the floor, same floor where they have a lot of other activities occurring. So, okay, so what did that look like from a cleaning and disinfection standpoint after all these turtles, half of which I'm guaranteeing were shedding salmonella at the time? What did that look like? How do we think about these different types of organisms that are involved? What do those standard operating procedures look like? And again, we can put all this together and we think about what those requirements look like. So bringing some of those animal restrictions that we talked a little bit at the beginning, we talk about formal evaluations, and that health and safety piece to ensure that we've got various types of protocols to ensure that we're restricting animals, we're trying to ensure that we're making good choices with the types of environments, the types of interactions, and what that looks like from a handler component. So I've thrown a ton out there. And by the way, this is painted cats for those of you that are interested. I don't know if any of you that own a cat, but we don't have any right now in our house. But when I did have a cat, if I tried to do this, I'm pretty sure that I would have definitely gotten a zoonotic infection. My email's there. Happy to take any questions and looking forward to conversation. So with that, I'll leave this up for a minute or two, and then I can take it down. And yeah, Martin, jump in.
Thank you so much. This was great. I love the animal assessments that you created there in the pictures, and we do have time for questions.
I I can start, Martin, if no one
Yes,
else is.
yeah, please.
I have actually a few questions, but I'll start with one. Hi, Jason. It's nice to see you again.
Yes,
That
you
was a
too.
great presentation. So you raised the point about lack of awareness of some of the facilities that you've been in. So
Hmm.
what would you say in terms of increasing awareness amongst those facilities, like how to do that, and
Yeah.
also what is their receptivity to somebody coming in and saying, you should do this, this, and this.
So first off, thank you, Jennifer. So first, the REB, the research ethics involved in us just doing a survey was ridiculous. It was ridiculous. There was a ton of concern about, and it was a voluntary survey. but there was so much concern about how this would be perceived, any negative. So we asked about, had they identified, zoonotic infections. Again, it was all anonymous. It was really, really tough. And it's a tough area to kind of break into because of some of these concerns. I didn't show it here, but we've done some work to look at zoonotic disease knowledge in a variety of different groups. I haven't specifically done it in this group, but I would say it's relatively similar probably to the general public, which is there's generally low awareness, especially when it comes to pets. So people think of pets as all these great things. They are less in tune with some of the risks. And so I think we need to think about how do we present those risks in ways that are palatable to folks. And we tried to come up with different ways of doing that. And so, for instance, in that fact sheet that we developed for nursing homes and long-term care facilities, we tried to help spell out some of those risks. And so part of the problem is that some of these aspects maybe are more understood by folks with, for instance, a veterinary background or similar. And it seems like most of these facilities do not engage veterinary professionals when they're thinking about putting together their protocol. So that's number one, is there someone they can engage with that might help them? And then number two, can we help spell out what some of those risks are? And generally, they're pretty straightforward. They're not overly difficult. So we've got certainly very clear species risks. We've got certain preventative care risks, but there's misconceptions like things like, well, all the animals, the dogs that come to my facility, they're all vaccinated against rabies and the core vaccines, therefore there's not going to be a zoonotic risk. I'm like, well, wait a second. Like, all right, we got lepto, we got rabies, but there's like lots of other zoonotic concerns that we don't have vaccines for. And so I think these are some of the challenges that we face. And I think the biggest thing is that I'm a big proponent in the fact that we're not saying no animals. We're not saying people that are immunocompromised shouldn't have pets or shouldn't be around animals. It's around how do you alter those types of interactions so that they're safer. And I know I'm like totally just vomiting stuff at you, Jennifer, but I have one more thing that I want to talk about, which I think is a really big one, which is when we talk about behavior change. And that becomes especially clear. It might even be coming in with some of these facilities that, for instance, they're used to what they're doing, and we're asking them to make a change. We definitely see this in households. So, for instance, immunocompromised people, we've done focus groups, immunocompromised people that are pet owners, and we're saying, okay, you've just told me that you developed a really nasty infection when your dog jumped up on you and scratched you, or whatever. And some of these individuals were actually on dialysis. And so asking them about what that protocol looked like, and they were taking zero precautions. So we started talking about, what would be your barriers to doing that? And the biggest barrier is that they perceived their animal as not loving them or not caring for them. All right. And so I think that's one of the big barriers that we need to think about too, especially when there's that strong connection already, is that the way people interact with their animals, they see that as part of the human animal bond. And we need to think about creative ways to change that. And I will say one of the most creative ways to change that is if we can help people understand that actually their activities can cause health concerns for their animal. So we talk about these concepts of reverse zoonoses or transmission of pathogens back to their animal. Now they will start to make changes. And so I think we have to really think about those drivers and what those barriers are. And they may vary in these different contexts, but trying to break some of those down and come up with, I think, reasonable ways to allow for safe pet contact and ownership. Does that help? Does that kind
Right.
of get
Yeah,
to some of
yeah,
your
no,
stuff?
thank you. I mean, it's a there's so many layers to it, and it's intriguing on so many levels. It's a great, I think, One Health topic, right? Because in including the medical community and their awareness, I think would be a great step.
Yeah. Oh, so we didn't even get there.
Yeah, yeah, we won't.
Right? Like, oh my goodness, it's so frustrating. And like ways to better engage. And I think when we talk a lot, there's a lot of talk, of course, about One Health, but how do we actually do that in a way that doesn't become like, as I said, there's not a lot of One Help in One Health. It seems like
Yeah.
veterinary profession is driving that for the most part. We need to figure out better ways to navigate and to help support our human health colleagues without
Hmm.
doing all the work.
Yeah. Great. Thank you.
Yeah, sure.
Other questions? So I had one what really resonated with me was this idea that people underestimate the risk and they overestimate the benefits of the human
Mm,
animal relationship. And I wondered, what are predictors of that on the human side?
mm,
You talked a little bit about age, young
yeah.
ones, older ones, of being susceptible, but is there data that we can profile that person, describe that person a bit better, so we know more who that could be, right? That is underestimating the risk.
I love that, Martin. So I don't know if good data are out there right now, but I think that could be is super useful. And this gets back to Jennifer's question. I mean, like, what are those barriers and those motivators? There have been a number of kind of different survey-based kind of approaches to better understand some of these things, but to my knowledge, I haven't seen anything that really unpacks that. But I think you're absolutely right. If we can identify those at greatest risk of overstating benefits, it's I will say I would also be wouldn't be overly surprised if we see that really common. And I saw that I encountered that quite a bit, where in some of our work, both within the public but also within various types of human healthcare facilities, where we recognize that people I think people are maybe might struggle, and there are probably other people on this call that know the psychology of this better than I do, but there's a lot of gray. And how do you navigate that gray with this type of interaction, where you might want to really dichotomize this as super dangerous or super safe, and come up with ways that are more you can navigate around that risk and what that might look like. And people, of course, have a tendency to think back on their own experiences. And of course, many of us on this call, I'm sure, are pet owners and around pets, and we're all still around and we're still alive. So therefore, it must mean that it's super safe. And it's just that there are certain groups that that risk gets higher, that we need to really focus in our attention to be a little bit more careful. I think it would also be interesting to look at, and not only that, but what are there different approaches to these interventions that either better resonate with people or are
Mhm.
better, more effective, I guess, at actually getting people to adapt their practices, and even most importantly, have long-term make people change their behaviors for the long term. So not just short-term changes, because we know that habits are oftentimes difficult to change. So if someone's used to that kind of connection, so for instance, feeding dogs out of or their pet out of their mouth, uh, absolutely, lots of people do that. How do we encourage people to change that and to repeat that behavior in a good way? But I'm
Mhm.
open for others to if others have other ideas or suggestions.
It's super interesting because in one of the tables that you showed is there's different kinds of interventions. One seemed very normative to me, like there was a policy in place, right? Others less so. So I wondered what would be predictors, like you just said, of adoption of some of these, and would say the normative intervention be less effective among a certain target group than other types of intervention would be really interesting to see.
And even amongst groups that we would think really should know better. And so here I'm talking about human healthcare facilities. And I've seen it for both extremes. People don't want to involve animals because they just consider it to be too high of a risk, or they're doing it without a good program in place, which I think just seems like a bad idea. So if we, again, if we don't put in a program in place, then how do we know if it's going to be successful or not? And unfortunately, when we talk about benefits of a lot of these interactions, a lot of it's going to come down to programs being able to justify that they're seeing benefits. I think, unfortunately, that's what it comes down to with a lot of these different situations.
Mhm. All right. Any other questions for Jason while we have him on the call?
I'll ask one more if no one else is jumping in. I don't see any other hands here. Jason, I don't think I'm putting you on the spot because I know you're at the vet school at PEI, but what would you say to students in training for a DVM in terms of potential roles for them either whether they're, it's a role directly engaged with the facility or even in practice with people who come in with their assistance animals. Like what would you tell them in terms of what they should be learning before as a day one ready vet?
Yeah, so in terms of like you're talking about providing preventative care recommendations for someone whose animal is involved in animal assisted therapy or something like that.
Yeah, I think so. And then also just identifying like if I'm interested in this area, what role
Mm,
could I play as a vet in
mm,
this,
mm.
beyond
Oh, yeah.
my client?
That's good. So the good news is that there's not a ton of information out there, so it's really, really easy to get up to speed.
Great.
There's a handful of documents that are recommendations. It even seems like a lot of people, even those within like infection control within human health facilities, are somewhat familiar, but just not integrating some of them. So I'd say one, be aware of what the recommendations are. And what evidence is there to support those recommendations. I think that's equally important. Number two, for instance, the AHA guidelines, those can be quite helpful in helping individuals better understand around things like screening, um, uh, those types of pieces. And then getting involved, I think there's lots of ways to really do so. So whether that's actively seeking out organizations in your area and offering your expertise, a lot of folks, I think, making those connections are sometimes difficult. So it encourage people to be involved. And so that involvement might start with maybe even just kind of if you have your own pet and your own animal and are interested in being involved in these programs, you start kind of as a participant and then can help shape a program. This can be hugely meaningful from a veterinary perspective, also somewhat helpful in terms of your own business, right? So we all have to think about how we live, but you obviously are promoting your name and promoting what you have to offer. And I think just the role that helping people better understand what role veterinarians can play in some of these things, I think we're less engage people are less likely to all engage us as maybe they should be. So trying to get your name into those types of spheres that can be helpful. So local public health, those are great places to volunteer time as a veterinarian. And again, certainly through human healthcare facilities, other types of programs. But part of that is also understanding what those expectations are for those programs. So I guess those are kind of some of the pieces that I think would become important, and so that you're doing it and you're being a part of it in a beneficial way.
Great. Thank you.
Yep.
All right. Um, if there aren't any other questions for Jason, then Jason, I would like to thank you for this wonderful talk. We really appreciate the food for thought, and I think there's lots to consider in going forward. And um, I wish you all the best for your continued work, and would also like to thank the audience for their attention and questions. Thanks.
Thanks. Well, you guys had my email, so any questions, interests, people want to chat, feel free to reach out. Thanks again for the invitation. I really enjoyed it.
All right. Have a
Thank you.
nice
See ya.